Let's discuss the extraordinary vessels. Pairing. Pairing and special functions. The 8 extraordinary vessels can be paired in several ways. The central vessels and the peripheral vessels can be coupled to form yin-yang pairs, or a central vessel can be paired with peripheral vessels. These pairs support particular regions and are very important in acupuncture therapy. Pairing according to yin-yang polarity. Pairing of the extraordinary vessels according to yin-yang polarity. So we have here the yin vessels, yang vessels, the functions, and the general functions. For the central vessels, the Ren Mai, the yin vessels, and the yang vessels, the Du Mai, the functions of yin-yang pair, Du Mai can be considered to be the first manifestation of Qi and Yang. The Ren Mai, the first manifestation of blood and yin. This pair stores the yin Qi and yang Qi. For the yin vessels, again, the Chong Mai and the yang vessels, Dai Mai, functions of the yin-yang pair. The Chong Mai is like a harmonious connection between yin and yang. It expresses vitality and sets impulses. The Dai Mai encircles, it is like a container and prepares the circulation of yin and yang. The pair circulates the yin, the essence Jing, and Qi between the yin and yang regions of the body. The general functions, storage and distribution of yin and yang, foundation of the 8 extraordinary vessels, stores essence Qi, is responsible for the support of the internal organs and extraordinary 2 organs, as well as for the fundamental body structures. For the peripheral vessels, the Yin Qiao Mai and the Yang Qiao Mai, this pair creates balance between yin and yang. For example, balance between essence, Jing and Qi, blood and Qi, left and right, nutritive Qi and defensive Qi, also on the outside, between day and night. Controls and regulates the ascending Yin Qiao Mai and descending Yang Qiao Mai movement in the body, is responsible for balance and rhythm between yin and yang. For the Yin Wei Mai and the Yang Wei Mai, the Yin Wei Mai governs the interior. It organizes and creates connection within the yin aspect of the body. The Yang Wei Mai governs the exterior. It organizes within the yang aspect of the body. This pair connects the yin and yang respectively. That which moves and circulates between the yin channel is called the Yin Wei. That which moves between yang channel is called the Yang Wei. For the functions, balance, circulation, and connections of the yin and yang aspect provides contact between the distal region of the body and the torso and head. Central peripheral pairing. Here, a central vessel is combined with a peripheral vessel. This pairing probably refers to regions of the body which are transversed and supplied by the pair. So we have here the central peripheral pairing of the extraordinary vessels. For the pair, first pair, or pair 1, the vessels Chong Mai and the Yin Wei Mai, the relationship father-mother, the opening point, spleen 4 and PC6. Coupling point, PC6, spleen 4, supported region, head, thorax, and stomach. For the pair 2, Du Mai and Ren Mai, the relationship is husband and wife. Opening point, SI4, bladder 62. Coupling point, bladder 62, SI3. Supporting region, inner canthus of the eye, occiput, shoulder, and back, SI, and bladder channel. Next, the pair 3, the Dai Mai and the Yang Wei Mai, the relationship man and woman. Opening point, GB41, TB5. Coupling point, TB5 and GB41, and the supported region, the lateral eye and temple region, ears, cheeks, occiput, and shoulders. Next pair is fourth, The vessels is Ren Mai and Yin Chao Mai. The relationship is host and guest. The opening point, lung 7 and kidney 6. The coupling point, kidney 6, lung 7. Supported regions, the face, throat, thorax, lungs, diaphragm, and abdomen. Thank you for your attention.
Let's continue with the liver divergent channel. The liver divergent channel separates from the liver primary channel on the dorsum of the foot, ascends the medial aspect of the leg to the inguinal region, meets the gallbladder divergent channel near REN2, traverses the abdomen and enters internally at liver 13. Continues inside the thoracic cavity, spreads in the liver, connects with the gallbladder and runs to the heart, ascends to the neck, emerges at the mandibular angle and disperses over the face, then connects with the gallbladder primary channel and the gallbladder divergent channel at GB1 on the outer canthus of the eye to form one of the 6 who confluences. Here we have the GB liver as second confluence, continues to the eye system and ends in the brain. Clinical importance: strengthens the relationship between the liver and the gallbladder, zangfu-Organ systems. Points on the liver primary channel can therefore be used to treat disorders of the gallbladder and vice versa. Based on the pathways of the gallbladder and liver divergent channels, points on both channels can be used for disorders of the hips and the lower extremities, as well as for disorders of the eye system. The liver channel of foot Yin is interiorly exteriorly coupled with the gallbladder channel and paired with the pericardium channel of hand Yin according to 6-channel theory. The liver-gallbladder relationship is further strengthened by the fact that the liver primary channel connects with the gallbladder fu. The liver-luo connecting and divergent channels connect with the gallbladder channel. It is also interesting to note that the liver primary, luo connecting, and sinew channels go to the genitals, whilst the divergent channel ascends to the pubic region. The liver primary channel enters the lower abdomen. The liver primary channel curves around the stomach. The liver primary channel spreads in the lung, and the liver primary channel ascends just posterior to the throat. The liver primary channel passes through the nasopharynx. The liver primary channel links with the eye system, the tissues surrounding the eye. The liver primary channel ascends to the vertex to intersect the governing vessel at 220, the highest point reached by any yin channel. The liver has 5 primary functions: storing the blood, spreading, maintaining the free flow of the qi, dominating the sinews, opening into the eyes, manifesting in the nails. In addition, the liver zang belongs to the wood face and corresponds to wind. The liver governs uprising, and in disharmony, its qi may therefore rise excessively. The liver is entrusted with the Mingmen fire, which in disharmony may easily flare upwards as pathological heat. The liver free-flowing function assists the qi movement of the zangfu, especially the descending of lung and stomach qi and the ascending of spleen qi. The liver free-flowing function assists the qi transformation function of the bladder. The liver stores the ethereal soul, the hun, and as the wu zang is the mother of the heart. The liver stores the blood which flows into the conception and penetrating vessels to become menstrual blood, and its qi is responsible for the smooth flow of menstruation. The liver is closely associated with such emotions as anger, irritability, fractiousness, frustration, resentment, depression, weepiness, and mood swings. Thank you for your attention.
Let's continue our discussion on the Renmai or conception vessel. For now, let's talk about points overview. As a whole, the Renmai or conception vessel cannot treat gynecological problems without points of the directing vessels. It also affects the genitals, the abdomen, the throat, and the face. The Renmai channel nourishes the yin, establish communication between lungs and kidneys, regulate the triple burner, and affects the membranes. Now let's go to the points. Ren 3 is good for the bladder and for excess menstrual conditions. Ren 4 builds yang, a tonification point, is good for fatigue, for deficiency menstrual conditions, and for coldness. Ren 6 is for Qi tonification and for menstrual issues. Ren 8 is for the middle burner tonification. It warms. It is also good for the urea. Ren 12 is the meeting point of the yang organs. It subdues rebellious qi and is indicated for digestive problems. Ren 13 is similar to Ren 12, but it is more for stagnation issues. Ren 14 is the front view point of the heart. It is a good spirit point. It is also indicated for epigastric problems and for hiatal hernia. Ren 17 dominates qi of the body. It is indicated for asthma and bronchitis. Ren 22 subdues ascending qi. It's good for hiccups, for asthma, for sore throat, and for thyroid problems. Ren 24 is good for facial conditions or facial problems. Now, let's now go to points according to region. For the local points, for the throat, we have Ren 23. For the lungs, we have Ren 22 and Ren 17. Problems with the heart, we have Ren 17. And for the spleen and stomach, Ren 12. And for the small intestine, we have Ren 14 and Ren 19. For the bladder, we have Ren 3. For urogenital region, we have Ren 3 and Ren 4. For the epigastrium, we have Ren 12 and Ren 13. For the abdomen, we have Ren 3 and Ren 4 and Ren 6. For the adjacent points, for the throat, we have Ren 22. The tongue, we have Ren 23. For the heart, we have Ren 14. For the gallbladder, we have Ren 11. For the kidneys, we have Ren 4. And epigastrium, we have Ren 18. Now, distal point is ascribed to the Ren meridian. Next, we have the specific points according to the vessel pathways in numerical order. Ren 1 is the Jiaohui meeting point with the Chong Mai and Du Mai. It is also the Sunsi Miao ghost point. Ren 2 is the Jiaohui meeting point with the liver channel. Next, we have Ren 3. It is the Jiaohui meeting point with the spleen, liver, kidney channels. It is the front midpoint of the bladder, the local point for the bladder, urogenital region, and lower abdomen. Ren 4 is the front midpoint of the small intestine, the Jiaohui meeting point with the spleen, liver, kidney channels, and the local point for the small intestine, urogenital region, and lower abdomen. It is also the adjacent point for the kidneys. Ren 5 is the front midpoint of the triple burner. Ren 6 is an important general tonification point, the local point for the lower abdomen, and the adjacent point for the lung. Ren 7 is the Jiaohui meeting point with the Chong Mai and the kidney channel. Ren 8 is the adjacent point for the epigastrium. Ren 9 is the local point for the small intestine. Ren 10 is the Jiaohui meeting point with the spleen and stomach channels. Ren 11 is the adjacent point for the gallbladder. Ren 12 is the Hui meeting point of the Fu organs, the Jiaohui meeting point of the SI, triple burner, and stomach channels, the front view point of the stomach, the local point for the spleen and stomach, and the epigastrium. Ren 13 is the Jiaohui meeting point with the stomach and SI channels, and the local point of the epigastrium. Ren 14 is the front view point of the heart, the adjacent point of the heart. Ren 14 is the luo connecting point, an important point for calming. Ren 17 is the Hui meeting point of the Qi, the Jiaohui meeting point with the spleen, kidney, small intestine, and triple burner channels. It is also the front view point of the pericardium, the point of the sea of Qi. It is a local point for the lung and the heart. Ren 22 is the Qiao Wei meeting point with the Yin Wei Mai, the window of heaven point, the local point for the lungs, and the adjacent point for the throat. Ren 23 is the Qiao Wei meeting point with the Yin Wei Mai, the local point for the throat, and the adjacent point for the tongue. Finally, we have Ren 24, Qiao Wei meeting point for the Dumai and the large intestine and the stomach channels. It is also the Sunsi Miao ghost point. Here we have an illustration of the Lu connecting vessel of the Renmai pathway. The Lu connecting vessel of the Renmai originates at Ren 15 below the xiphoid process and disperses over the skin of the abdomen. Its clinical importance. In pathology, it's good for pain of the abdominal skin in excess condition, and for itching of the abdominal skin in deficiency conditions. Thank you for your attention.
Let's discuss the Daimai girdling vessel, energetics. The girdle vessel stands on its own as it is the only horizontal channel in the body. It encircles the main channels, and because of this, it exerts an influence on the circulation of qi to the legs. Dividing the body in two halves, it harmonizes above and below. Energetics of the extraordinary vessels, governing, directing, and penetrating vessels, the three branches with same origin from the space between the kidneys. Penetrating vessels, the center of vortex, governing and directing vessels define back and front. Yin and yang stepping vessels define left and right of yin and yang. Yin and yang linking vessels define interior and exterior. Girdle vessels define above and below. Thus, the extraordinary vessels form an energetic vortex of the whole body which develops from the kidney in much the same way as the embryo develops along a central axis. The moment the sperm enters the ovum, it determines a ventral and dorsal surface, the directing and governing vessels respectively. When the cell first divides, it determines a left and right side, the yin and yang stepping vessels, and above and below the penetrating and girdle vessels, an interior and exterior, the yin and yang linking vessels, and the front and back directing and governing vessels. Thus, far from being secondary vessels, the extraordinary vessels are the primary energetic forces along which the whole body and all the other channels are formed. It is for this reason that Lei Shen called them the source of creation. The extraordinary vessels form a vortex of energy emanating from the center of the body, from the space between kidneys where the motive force resides. The penetrating vessel is at the center of this energetic vortex, as it is also the sea of the 5 yin and 6 yang organs, the sea of blood and the sea of 12 channels, and it starts from between the kidneys. The qi and blood of the penetrating vessels are then distributed all over the body in small channels at the defensive qi energetic level. When its qi reaches kidney 6, kidney 9, bladder 62, bladder 63, GB 26, it gives rise to the yin stepping vessels, yin linking vessels, and yang stepping vessels, and yang linking vessels, and girdle vessels respectively. Thus, the penetrating vessel can be seen as the origin of these 5 extraordinary vessels. The direct and governing vessels determine and define the coronal plane of the body. The girdle vessel defines the transverse plane, while the yang stepping and linking vessels define the sagittal plane. So we have here the illustration, the planes defined by the extraordinary vessels. In ancient texts, the extraordinary vessels were often compared to a family nucleus as follows. This was taken from the Greek Compendium of Acupuncture. Father, the penetrating vessel, Chong Mai, Mother, the linking vessel, Yin Wei Mai. Husband, the governing vessel, Du Mai. Wife, Yang stepping vessels, Yang Qiao Mai. The son, Yang linking vessels, Yang Wei Mai. Daughter, Girda vessels, Dai Mai. Host, directing vessel, Ren Mai. Guest, Yin stepping vessels, Yin Qiao Mai. Bearing in mind the Confucian social custom prevalent in China at the time, being the father, the penetrating vessel is the center of this family nucleus. Therefore, the most important of the 8 extraordinary vessels. Indeed, in the vortex of Qi created by the 8 extraordinary vessels, the penetrating vessel is of it. Thus, the extraordinary vessels regulate the following structures. First, the governing direct vessels, back and front, penetrating girdle vessels, vertical and horizontal, yin and yang stepping vessels, medial and lateral, and left, right, one of the yin and the other of the yang. Yin yang linking vessels, interior and exterior, yin and yang, nutritive qi and defensive qi. The study of the extraordinary vessels by Li Shen says that yang linking vessels control the exterior, which is the heaven. Yin linking vessels control the interior, the earth. Yang stepping vessels controls the left, right of yang, the east. Yin stepping vessels controls the left, right of yin, the west. Governing vessel controls back, yang, the south. Direct penetrating vessels control front, yin, the north, and the girdle vessel binds. So we have here the illustration of the planes defined by the extraordinary vessels according to Li Shen. Bearing in mind the above-mentioned energetic vortex of the extraordinary vessels, in treatment, one can relate the extraordinary vessels to body areas and physical imbalances. For example, harmonizing left and right means that the yang stepping vessels can be used for structural imbalances between left and right side of the body on the lateral yang side. For example, one leg longer than the other, one scapula higher than the other, etc. Thank you for your attention.
Now let's talk about the clinical applications of Yin Wei Mai, or the Yin Linking Vessel. Opening point is pericardium 6, coupled point spleen 4, starting point kidney 9, accumulation point kidney 9, area of body influenced, chest, heart. The Yin linking vessel connects all the yin channels. This is partly due to the fact that its opening point is P6, pertaining to the terminal yin, which is the hinge of the yin channels. So the yin linking vessel starts from kidney 9 and goes to the center of the muscle. It rises along the inner side of the leg to the lower central abdomen, where it connects with the spleen, liver, kidney, and stomach channels at spleen 13. It then rises and connects with the spleen channel at spleen 15 and spleen 16. It goes up to the hypochondrium, where it connects with the liver channel at liver 14. It goes up to the chest, diaphragm, and throat, where it connects with the directing vessel at the point REN 22 and REN 23, then rising to the forehead, where it ends. These are the points of the Yin linking vessel: kidney 9, which is the accumulation point, spleen 6, spleen 13, spleen 15, spleen 16, liver 14, REN 22, and REN 23. Since it connects all the yin channels, the yin linking vessel can be used for deficiency of blood and or yin, especially if accompanied by psychological symptoms such as insomnia, anxiety, mental restlessness, thinking too much, obsession, loss of willpower, and lack of self-control. In this context, it has a remarkable effect in calming the mind, especially in women, and is especially effective combined with its starting and accumulation point, kidney 9. Since the yin linking vessel nourishes blood, it has a tonifying action on the heart and can be used for chest pain or a feeling of stuffiness, oppression or tightness of the chest, anxiety, apprehension, depression, or nightmares. The association of the yin linking vessel within the mental state is very old and is mentioned in chapter 41 of the Simple Questions. The Great Compendium of Acupuncture lists among many other symptoms. Knot in the chest, which feels tight and full on palpation. So we use P6, P7, REN12, spleen 6. Stagnant chi, easily losing control, too much thinking, melancholy, sadness, pain in the heart and abdomen. P6, bladder 12, REN17, P8, stomach 36. For sadness and crying, P6, heart 5, SI3, heart 7, kidney 4. Forgetfulness, mental cloudiness. So we have P6, bladder 15, heart 5, heart 9. Anxiety, P6, stomach 18, heart 5, bladder 15, bladder 19. Heart and gallbladder deficient, shock, palpitations, P6, bladder 19, heart 5, GB41. The Yin linking vessel is excellent to treat depression and sadness in women occurring against a background of blood deficiency. Needle P6 on the right, spleen 4 on the left, REN15 and kidney 9 bilaterally. The Yin linking vessel is effective in treating headaches from deficiency of blood, especially if they are at the back of the neck. This is due to the fact that it nourishes blood and its opening point P6, being also the connecting point of the pericardium channel, affects the triple burner channel area on the neck. Thank you for your attention.
Ayong pag-end nyo. Now let's talk about the Yin Wei Mai or the Yin Linking Vessel clinical applications. Let's have first a quick review of the Yin Linking Vessel. Its opening point is triple burner 5. Its coupled point is GB41. Starting point, bladder 63. Accumulation point, GB35. Area of body influenced, the lateral aspect of leg, sides of body, lateral aspect of neck and head and ears. The Yin linking vessel connects all the Yin channels. The Yin linking vessel starts at bladder 63 and goes up to GB35, which is its accumulation point. It travels up the thigh to the gallbladder 29, rises up the hypochondrium and to the shoulders at LI14, where it connects with the large intestine, small intestine, and bladder channels, then ascends to triple burner 13 and triple burner 15. It then goes to gallbladder 21, where it connects with triple burner, gallbladder, and stomach channels, goes to the back of the shoulders to small intestine 10, where it connects with small intestine channel and the Yin stepping vessel. It then rises up behind the ear to reach GB20, where it intersects with the triple burner and gallbladder channels, goes to GB19, GB18, 17, 16, 15, and to the forehead to gallbladder 14, where it connects with gallbladder, triple burner, large intestine, and stomach channels. It then proceeds to the forehead, enters the eye, and ascends to gallbladder 13. Here are the points of the Yin linking vessel. We have bladder 63, gallbladder 35, gallbladder 29, LI14, triple burner 13, triple burner 15, gallbladder 21, SI10, GB20, GB19, GB18, GB17, GB16, GB15, GB14, and GB13. Its clinical applications. First, for intermittent fevers. The Yin linking vessel is used for intermittent fevers on alternation of chills and fever. These are symptoms of affection of the lesser Yang stage in the 6-stage patterns of penetration of exterior pathogenic factor. The symptoms at this stage is alternation of chills and fever because the pathogenic factor is lodged half in the interior and half in the exterior. Some doctors say that all the yang channels are linked by the yang linking vessel at gallbladder 20. They say that this point's action of expelling external wind is due to its relation with the yang linking vessel, not the gallbladder. On the other hand, its action of extinguishing internal wind is, on the contrary, due to its relation with the gallbladder. For the sides of the body, the yang linking vessels exerts its influence on the sides of the body and is used for such symptoms as hypochondrial pain, pain in the lateral aspect of the leg, such as sciatica along the gallbladder channel, and pain in the lateral side of the neck. For ear problems, the yang linking vessel affects the ear and can be used for ear problems due to the rising of liver fire, such as tinnitus and deafness. It can also be used in any ear diseases caused by a gallbladder disharmony, such as ear discharge from damp heat in the gallbladder. Thank you for your attention.
Let's discuss the Yin Qiao Mai, Yin stepping vessels clinical applications. For the Yin stepping vessels, the opening point is kidney 6, the couple point lung 7, starting point kidney 6, accumulation point kidney 8, area of body influence, the inner side of the legs, abdomen, only unilateral symptoms, and the eyes. 8 extraordinary vessels function as reservoir to absorb the excess of qi from the main channel. The yin and yang stepping vessels represent the first line of reservoir, which absorb excess of yin or yang respectively. However, they do not perform this function in the same part of the body. The yin stepping vessels absorb excess of yin in the abdomen, while the yang stepping vessels absorb excess of yang in the head. The yin and yang stepping vessels are closely related, especially in their relationship with the eyes. They both flow up to the eyes, the yin stepping vessels bringing them yin energy, the yang stepping vessels bringing them yang energy. When the yin stepping vessels is diseased, the eyes cannot stay open and tend to close all the time. That is, the person feels constantly sleepy. When the yang stepping vessel is diseased, the eyes cannot close and tends to stay open all the time. For example, the person cannot sleep. The yin and yang stepping vessels also exert an influence on the tone of the leg muscles. When the yin stepping vessel is in excess, the inner leg muscles are tight and the outer leg muscles loose. When the yang stepping vessel is in excess, the inner leg muscles are loose and the outer ones tight. The yin stepping vessel is an offshoot of the kidney channel, while the yang stepping vessel is an offshoot of the bladder channel. Yin stepping vessel summary pathway. It originates inside the heel on the medial side, goes to kidney 2, ascends to the internal malleolus, and then to kidney 8. It rises on the inner leg and thigh to reach the genitals. It ascends abdomen and chest and connects with stomach 12. It goes up to the throat, connecting with stomach 9, and then to the eye, bladder 1, where it meets the yang stepping vessel. Points of the yin stepping vessels: kidney 2, kidney 6, kidney 8, stomach 12, stomach 9, bladder 1. Clinical application: the yin stepping vessels and sleep. Because of its relationship with the eyes, the yin stepping vessel can be used in disturbances of sleep, whether insomnia or somnolence. In this context, it is often used in conjunction with yang stepping vessel. In cases of insomnia, the yin stepping vessel is tonified by tonifying kidney 6, and the yang stepping vessels drained by reducing bladder 62. In cases of somnolence, the yin stepping vessel is drained by reducing kidney 6, and the yang stepping vessels is tonified by reinforcing bladder 62. In both cases, the point bladder 1 can be added to establish a connection between the yin and yang stepping vessels so that the yin and yang energy in the eyes can be balanced. The spiritual axis also suggests kidney 6 for painful red eye. The yin stepping vessels and atrophy syndrome, Wei syndrome. The yin stepping vessels can be used in certain cases of atrophy syndrome when the muscles of the inner aspect of the legs are tight and those of the outer aspect loose and the foot turns inward. This makes walking very difficult and the person prone to tripping. The yin stepping vessel opening and coupled points can be used to balance the tension of the inner and outer leg muscles. Abdominal pain. The yin stepping vessels extend its range of action to the abdomen and can be used in excess pattern of the lower burner in women for such symptoms of abdominal distension, abdominal masses, difficult delivery or retention of placenta, all of which arises from stagnation. However, the yin stepping vessels is chosen only when the abdominal symptoms are unilateral. In the yin stepping vessels can be used to treat adhesion following surgery. Thank you for your attention.
Let's now discuss a pattern for cough, wind, dryness, invasion. Clinical manifestations: dry and ticklish cough, dry, itchy, sore throat, sore sensation in the upper chest, the trachea, dry lips, dry mouth, stuffy nose, headache, slight aversion to cold, mild shivers. Tongue will have slightly red sides and or front part. Pulse floating. Treatment principle: release exterior, restore descending of lung qi, promote fluids, and stop cough. Points: lung 7, lung 9, Ren 12, kidney 6, spleen 6. All are needled with reinforcing method, except for lung 7, which should be needled with reducing method. Lung 7 releases exterior and restores the sending of lung qi to stop cough. Lung 9 nourishes lungs fluids. Ren 12, the point marking the beginning of the lung channel's internal pathway, promotes fluids. Kidney 6 promotes fluids and benefits and moistens the throat. Spleen 6 promotes fluids. Case history. We have a 41-year-old man who had contracted an upper respiratory infection while holidaying in the Rocky Mountains in summertime. At the time, this manifested with symptoms of wind heat and dryness, that is, aversion to cold, slight temperature, dry cough, dry and itchy sensation of the throat, and a headache. He came for treatment on his return from his holiday when he still had a dry, persistent, and ticklish cough that was keeping him awake at night. Diagnosis: this was originally an attack of wind heat dryness that hadn't dried up the lungs fluids and left him with some dryness. Treatment principle: moisten the lungs, promote fluids, and restore the sending of lung qi. Thank you everyone for listening.